I am joined by my partner in crime, Susan Shepard Carlson, and the fabulous Chris Melfi, working in the policy sphere. So, Tom, I don't know if you have any updates right off the get-go, and then we've got some other updates on some cool things that are happening.
Well, Jen, I just want to welcome everyone here, but really welcome, I hope, all of you to Washington, D.C. in September, so less than a month from now. So we're very excited about the activities this year. It's bigger and better than ever. I think we have more people, certainly so. And you'll hear about all that, all the policy updates, all the good work that's been going on the Hill that we'll be needing to do in September and for the rest of the year, and Impact Week. But needless to say, this is it's a big moment for FASD United as we've rebranded and we continue to grow. And you all have been dedicated to this cause, and we thank you so much. You've supported us with the policy forum and all the policy activities and all of our work. So we're really excited to see you. So Jen, thank you. Take it away.
Great. So, coming up, for those of you that don't know, we do have an affiliate network that spans the country and Scotland as well. And that is a group of 47 autonomous organizations, all working in FASD, collaborating, sharing ideas, exchanging ideas, information. And we really encourage you, if you're part of an organization that does work in the FASD space, to join us. It used to be you could only have one per state. That is definitely not the case anymore. We've got people joining all over the place. There's states with 3, 4 affiliates in it. And I'm thrilled to announce that we will have a new affiliate director starting Monday. We will let everybody know in an announcement there. So moving on from the affiliates, and we're really grateful for the work they've done. Next slide, please. Just a reminder that the call for abstracts for the research conference on FASD happening in Seattle in March, the call for abstracts is done on September 23rd. So really encourage you that if you're in the research space, if you're working with populations in the FASD space, to submit a poster, submit a project, submit a talk, and participate in that way. That's our West Coast arm. So thank you for that. For those of you that have already submitted abstracts, because we've had quite a few come in. FASD Awareness Month is coming up, and I really want to point this piece out. The website, on our website, and then also through that link, we have a huge amount of resources ready to go to help you celebrate FASD Awareness Month. For example, we've got sample press releases. We have sample social media posts, both coming from a person and then also coming from an organization. And that comes with not only the post, but what you can say with it on your social media. So if you haven't gotten around to getting your FASD Awareness Day social media stuff, or FASD Awareness Month social media stuff done, download it from there and use it. It's done. It's done for you. So really would suggest checking that out and seeing if there's anything there that could be helpful to you or your organization or your advocacy.
And Jen, just to add really quickly, there'll be a blog post up tomorrow with a quick recap of this video, and all of the links and the documents that you see will be available there for your ease.
Tom mentioned a bit about Impact Week. We had assumed incorrectly that it might be a smaller Impact Week this year because of all of the participation in the Seattle Research Conference, and we were wrong. Happily so. So we're really excited to see everyone in DC that can make it, and we've got some options for people who can't as well coming up. So just pointing out that's happening from the 16th through the 18th of September. So you may have a little difficulty getting hold of staff during those days because we'll be knee-deep in Impact Week, but we'll still be around to help you out. And one of the things and one of the ways that you can participate during Impact Week is we do have a screening for the FASD community of a film produced by an Emmy award-winning producer and his son, talking about the transition to adulthood with disability, which includes some FASD, an FASD self-advocate. And so we'll be doing a virtual pre-release screening, also in person, a screening at Impact Week. So there'll be folks being able to watch it in live time along with you at home, and a talk by the filmmakers and a Q&A session by the filmmakers. So we're really excited for that piece, and hope that many of you can join us in viewing that. And just another reminder that Run Fast is going on now. Shirts and medals and race tags are shipping. Our office is abuzz with all of that. And know that you don't have to run. You can walk, or like me, meander slowly. I thought I was going to be able to run it this year. No, I'm meandering slowly this year. And look for a rebrand of this next year as you're planning for FASD Awareness Month next year. We'll be doing a move fast, move FASD as opposed to a run fast, because we recognize that not everybody's built for speed, and we want to be as inclusive as humanly possible. And there are a few in-person events that you could attend if you don't want to do it on your own. And this is just a great way to get community together and go walk around your community or run around your community in a shirt talking about FASD and get conversations started. So appreciate everybody who's been involved in that. All right, so on to the main event, the policy. For those of you who are joining us for the first time, a lot of what we're talking about has to do with the FASD Respect Act. And we call it the 2.0 because it is slightly different from the bill that was introduced the congressional session prior. For those of you that don't know, congressional sessions run in a 2-year cycle. So you have 2 years to pass a bill. And so this is our bill. This go round is containing information that, or legislation that would promote education, awareness, and services in states. So sending money to states to begin looking at how FASD can be weaved into existing systems of care. Building state and tribal systems. How can they work together to include FASD, give FASD a seat at the table, and then bring back the FASD Centers for Excellence that would help inform the states and the government agencies on best practices and not reinventing the wheel, not wasting time, effort, or money on how to work in the FASD space in the most effective, evidence-based way. So that's kind of the general contents of the bill. So the bill is S 1800, House Bill 3946. Boy, I was having a memory gap there. Introduced in the Senate by Senators Murkowski and Klobuchar, and in the House by Representatives Bacon and McCollum. So it's a bipartisan bill. There's nothing contentious in this bill, and that's a really nice thing. It's reauthorizing programs that have gone away and kind of updating them and elevating the language of FASD to be far less stigmatizing. Looking at where the bill is now, on the House side, on the Senate side, the House has passed through the committee of jurisdiction that it needs to pass through, Health, Education, Labor, and Pensions, and is waiting to go to the Senate floor for a full Senate vote, tucked into a larger bill, the Support Reauthorization Act. On the House side, it is not tucked into that bill, but if it passes the Senate in the Support Reauthorization Act, the Support Reauthorization Act has already passed the House. Those two will have to come together in conference, and they'll have to decide, see where the differences are and decide what staying, what's leaving. And this is why we really need to hit up our members of the House with the FASD Respect Act, so that when they see that language and they see that difference, they don't flag it as something they don't want. So we have been told that, and again, this is a repeat for many of you, but that the Support Reauthorization Act will likely not move until the lame duck, which is the period after the elections in November, which is why September and forward is such a critical time to be reaching out to our legislators and getting them on board. There are a whole bunch of bills that are going to need to pass during that lame duck period. That's a period of really intense, actually bipartisan typically, but intense flurries of bills going through and intense priorities going through, because everybody's come back from the campaign trail and, oh gosh, we got to govern the country too, right? We got to pass some legislation. So this is why our advocacy is going to be absolutely critical over the coming months, because we have until December, into December, when the House and Senate shut down, to get this passed. So currently we have 51 co-sponsors in the House and 12 in the Senate. We have more co-sponsors in the Senate than we've ever had before. And we are just a little shy of our record in terms of co-sponsors in the House. So House focus is going to be really big for us coming up. Susan or Chris, any comments, suggestions, thoughts on that?
No, I think you said it very well. The only thing I would add is the reason a lot of the stuff does wait until after the election is a lot of them, they didn't want to have them take a bad vote on bills. And so rather than during an election period. And so that's where there's a little freeing up of what they will do during the lame duck. So we're optimistic. But as Jen said, that's why September is really critical, because they're going to be in session in September, and they will be there when we're there. And then October, they're gone. And so you can hit them in their districts, but September is really a good time. So I hope, it sounds like we've got a good contingent on the Hill this in Impact Week.
Jen, thank you for adding that at the end there. I really appreciate that, and same to you, Susan. I know you mentioned that we are lagging a bit behind in terms of co-sponsors in the House, but with Hill Day coming up and some recent meetings, we hope to add to that and get back up there. In terms of what happened in August in the policy sphere for both FASD and the developmental disability space, the California contingency led a meeting with Representative Anna Eshoo last week. She is a key congressperson because she sits on the subcommittee, the Health Subcommittee of the Energy and Commerce Committee. As Jen mentioned, that is a critical committee for us. If the Support Act were to pass the full Senate, it would then meet in conference with leadership from that House committee. So educating them, making sure that they're FASD aware, socializing the bill is incredibly important. There's a meeting coming up later this week that will be led by the Texas advocates with Representative Vicente Gonzalez. I believe he would be the 8th co-sponsor from Texas if he were to sign on. The Texas group has been incredibly active, just a real force, very unified. It's a joy to work with them, and they're definitely a model. Not a typical meeting, but we were able to send some materials to support an affiliate that manned a booth at the National Conference of State Legislators earlier in August. And I'll leave it at that. We'll add a little bit more information about that later on in the presentation. As with every month, we had many endorsements come in. But I just want to point out a few that were very important. The American Psychiatric Association authored their own letter supporting the FASD Respect Act. And Jen or Susan, I'm not sure if you want to add anything and as to how that came about.
Yeah, one of our advocates from California actually really pushed to get that done. She's a physician in the state of California and really worked with that group to let them know how important it was. And I think what this highlights is that if you're a member of an association, a group, a union, a any kind of organization, a Rotary Club, you name it, Chamber of Commerce. These are organizations that can send a letter of support for either FASD or the FASD Respect Act, depending on where they sit. So it's just a really good reminder to really look to your networks and look at who you connect with and see if they're willing to support, endorse, write a letter, help us out.
Yeah, I just want to say that American Psychiatric Association endorsement is big. And they actually sent a letter to the chairs of the committees. And so that's impressive that they would take it upon, and it was a very well-written letter. So that was big.
And these endorsements can be used, they can be sent to your legislators, or I know that some advocates, Melissa, I think you're on here. I know you like to send these around to other organizations that you're hoping to get endorsements from. And it's very, very helpful to see an influential organization like the APA signing on. We also had Facets sign on. SCFASD Collaborative signed on earlier this month. And numerous medical professionals from Texas. This is a recurring theme every month. Really want to give a thank you to Mara and again, Melissa, for really being dedicated to spreading FASD awareness, particularly in the medical community. It's very much appreciated, and it's very, very important work.
And I did want to note in the chat, Chris, Michelle Traeger made a really great comment, and this is a great piece of advice. Anytime a big endorsement comes in, it is a reason to reconnect back with your legislators. So one big endorsement for the country gives everybody and all the advocates in the country an opportunity to reconnect with their legislators. And hey, I wanted to share this with you. It's not just this one voice, it's a collective voice of many. And oh, look, here's something new. So it gives you a reason to go back. Because sometimes I think we struggle with, okay, I've talked to them, now what, right? These endorsements can help with that.
Yeah, that's a really good point. And I know, I think I saw Liz McHugh on the call. I know, Liz, you're really good at that. And anytime there's a new update, reaching out to Tim Kaine or Senator Mark Warren or anything like that, very good point. Shifting to some disability news around the country, the National Council on Disabilities put out a report earlier this month outlining the exclusionary practices that some clinical trials are using that prevents people from disabilities from participating. I found this particularly interesting because they found that disability has not been included in recent efforts to enhance diversity within clinical trials. Of note, they mentioned that 90% of people with Down syndrome will develop Alzheimer's by the age of 55, but clinical trials for Alzheimer's therapeutics have excluded totally people with Down syndrome. This seems like it will lead to negative health outcomes, similar to what we have seen for women and people of color. I think this is a really important table for the developmental disability community to be sitting at. And it really just got me thinking about how FASD might be affected in this way. So it's just something I definitely want to keep an eye on. And I think is just really good food for thought in terms of awareness and health equity. Our last note here, spotlight on developmental disability, regards Gus Waltz, the son of Minnesota Governor Tim Waltz and current vice president candidate. He was in the spotlight a bit last week during the DNC with his really emotional and heartwarming display towards his dad and the developmental disability discourse that it brought with it. Gus is has a nonverbal learning disability, and in a couple articles that I was reading, there were some really interesting quotes from some doctors where they were highlighting that this disability is underdiagnosed, oftentimes misdiagnosed as autism. And I just want to read one quick quote from a doctor who took part in one of these articles. Without an officially recognized diagnosis, it is hard for parents to understand how to seek information and then communicate to other people what kinds of things might be challenging for their kids. The reason that stuck out to me in particular was because I have heard that in terms of FASD before, and I thought that was something that might resonate with people. And I was very glad to see all of the discourse happening surrounding this, mostly positive, but really just shining a light on the need for awareness for all developmental disabilities.
Yeah, Chris, I really do think that was a teaching moment that was, getting away from the politics of it. And there were some negative, tweets or whatever we call them now. But I think it became a teaching moment for those with disabilities and perhaps invisible that, that could be learned and hopefully will be learned.
Yeah, I think that was the part that hit me the most, that it was bringing awareness to non-apparent disabilities and talking about misdiagnosis, underdiagnosis, and everything like that. And besides that, it's just a beautiful moment of a son being proud of his dad.
Yeah.
So it's very nice to see. Okay, so jumping back to the National Conference of State Legislators, I was hoping to see Chris Trout's name pop up on the attendance list, but I'm not seeing it. So Jen, feel free to jump in if you want to mention anything.
Yeah, so we talked about this a little bit last month. One of the things that FASD United is doing going forward is partnering with our affiliate network. And when the National Conference of State Legislatures comes to town, as it does every year in the summertime, having a booth, a table, a presence at this meeting in cooperation with our affiliates. So this year it was in Kentucky. And next year it'll be in Boston. I was wrong. It's not in Chicago. It's in Boston next year. So we'll be working with MassFAS on this for next year. And we provided the booth, the materials, and then the affiliate provides the staffing to be able to have conversations and have a presence without spending money to fly somebody out, fly a booth out, it's an economical way of extending our reach, a force multiplier, if you will. And so there were over 5,000 lawmakers and staff in attendance. So they were a little surprised that there were so many people from other countries there as well. There were other countries represented. We did provide a number of handouts on justice, on policy, on the not on the Respect Act so much because it was state, on our Family Navigator system. The most common things that people wanted to take were the affiliate network flyer because they wanted to see and connect with the affiliates in their states. And then also the recently produced data sheet on education and FASD. Both of which are available on our website. And I thought it was a really great way to be able to connect with state legislators above and beyond the work that everybody's doing in their states. Because, we're working on federal policy, yes, and it has to go hand in hand with an approach for state policy. And this is a way of elevating that. So look for us in Boston next year at the conference again. And as we're able to grow this momentum, we'd like to be able to submit some abstracts for talks. We'd like to be able to have a more active presence in the space. But I think this is part of giving FASD a seat at the table, is being there, being in the room where it happens, right? And I think that's an important piece of the puzzle. So look for this kind of approach at other disciplines as well as we go into the next year. This is, I think, a way, again, of force multiplying what we're trying to do. And again, I thought it was really interesting, the in-depth interactions that were tracked there, with Nigeria, with Germany, with India, with Australia. It was neat to see that there were other countries represented there as well, and being able to have those communications and that awareness raised on a global level, not just on a state level.
And I think I mentioned this before when I used to work for the Minnesota legislature. I attended this conference several times, and it's a good opportunity for issues like this that are not well known in the States, to have that exposure that they can bring back. So I'm really happy we're doing this.
Yeah, thank you, Jen and Susan. Joel asked in the chat, I know his answer, but next year in Boston will be August 4th through 6th. And just want to reiterate what Jen said. It's just a fantastic opportunity for collaboration between us and our affiliates to promote state legislation. And I wish Chris was on here so we could give her a big thank you, but I'm sure she knows we appreciate what she did.
Well, and I do think once the Respect Act passes, it'll be a great opportunity to share that knowledge, and they can bring that back to staff and to other legislators, because it's something tangible that they can work on.
Okay, so as promised, we wanted to talk about a few ways that individuals who are not attending Impact Week can stay involved moving forward. And one way is through a virtual Hill Day. So we hope to hold this either in October, possibly early November, but just wait for a final announcement on dates at the next policy forum. But as we said, this offers everyone in the community a chance to connect with their lawmakers. If they want help setting up those meetings, if they want some help sitting in on those meetings, we're more than happy to help in absolutely any way we can. And these could even serve as a follow-up for those who do attend Hill Day, but want a reason to check in with the legislators that they talk to. You can always set up a meeting with someone that you met with, let them know that during Impact Week in Washington, D.C., X amount of people went to the Hill to advocate, let them know if any new co-sponsors came on. But I think this is a good idea to kind of keep the momentum going, keep people involved, and make sure that legislators understand that it's not a one and done thing for us. We're not just coming in September once and then going home. Not to keep the pressure on, so to say, but just to keep the awareness up and keep the education going. So again, keep an eye out for an announcement for date or dates coming in September. If you're looking ahead and know that this is something you're interested in, you want to get some meetings set up, feel free to reach out to me right away. Just know that until Hill Day and Impact Week is all done, that will definitely be the priority, but really, really looking forward to this. If you have any questions ahead of a final announcement, again, feel free to give me an email or a call. Going into our physical Hill Day on the Capitol. For those who are attending, this will be the shirt that you'll be receiving at check-in. As soon as you check in at the hotel with us, we'll hand you the shirt. The one on the left is the front, just to make sure everyone is crystal clear on that. And the right with our logo, not rare everywhere, will be the back. It looks a bit blue, bit navy dark blue here, but it will be a black shirt. So you can plan your outfits accordingly. I know last year the shirts were a big hit. A lot of people got stopped. They're a great conversation starter. I know I wear mine around here and get stopped quite often. So I hope everyone who's attending signed up to get a shirt. And for those who are not attending, we will have some left over for purchase. Just keep an eye out for that in October. So as you sign in for Impact Week at the hotel, there are a few items that you'll receive that are specific to Hill Day. So I just want to run through those. Here on the left, we'll have our the agenda for Hill Day. And on the right, you'll see the Capitol Hill map. If you have any questions throughout the week or throughout the day about getting around, transportation, where you need to go, please find me, find Jen. I think Tom would be a great resource as well, or Susan. I did include my name and number on the bottom left of the agenda. Feel free to give me a call at any time. The top number, 202, is my work phone. That's best for calls. If you need to get a hold of me urgently, feel free to shoot a text over to the 315 number. Running through the agenda for Hill Day, we will all meet at the hotel conference room where all of the activities are happening at about 9 a.m. So we will run through talking points, some things to remember. We'll have the huge primary schedule up on the board so you can receive any last minute updates. If you're not sure, if you are hoping to be paired up with a more experienced advocate or anything like that, we've already taken that in consideration. So this will be a time for you to meet with them and speak with them, see who you'll be with. And we'll also go over just a few last minute details there. It'll also be an opportunity for you to pick up your leave behind packets, and I can go through those in just a few minutes. Just like last year, we will have the individual meetings set up between roughly 10 a.m. and 5 p.m. So we'll all head to the Hill individually or in groups. Again, we're not providing transportation, but we are more than happy to help you set up your ride shares. Also included the easiest way to get to the Hill using Metro. Tom or anyone else in the area, please let me know if you think this is a roundabout way to get there, but I think this would be the best way. It's maybe a 15-minute walk to the Metro from the hotel. And then once you get up to Capitol Hill, it's about a 5 or 10-minute walk to any of your meetings. Also in the packet will be included these talking points. Now these are not meant to be exhaustive by any means, and we are not telling you that this is what you need to or even should say. This is really just meant for you to take a peek at if you kind of get lost in your conversation or need any specifics that you want to cite. Of particular use may be the talking points on the right that talk a little bit more about the FASD Respect Act. Again, on the morning for the kickoff, we're going to go through a lot of the specifics for the Respect Act. Susan will give us a little history of programming and funding, if that's something that you think you'll want to talk about. And again, if you're interested in having a member of the FASD United team or anyone else who's attended a lot of meetings, please let me know, and you can have that person join you so you can feel as comfortable as possible. And that way you can focus on whatever your strengths are as an advocate and let somebody else talk about the legislation itself. Just want to show everyone what the packets and folios will look like that you'll receive when you check in. So you'll receive this. Inside will be your name tag. On the back will be a QR code for easy registration and some other information. On the inside of your folder will be your individualized schedule. And I apologize if this is not in frame. I can only see the slides, but on your schedule will be the time, the location of your meeting, who you're meeting with, and any other advocates that will be joining you. As mentioned before, we'll also provide some leave behind materials. These will be out on a table during the kickoff event. I will also be sending these out as attachments in the next week. So feel free to print them off ahead of time if you know there's some you're going to want, or to review them. The FASD Respect Act state sheets just highlight how the FASD Respect Act and how FASD affects individual states. So it has a few pieces of information on the amount of people affected by FASD, the economic costs in your particular state. The one pager is a great leave behind because, as its name implies, it's one page. It's very easy for the staff to take in. It gives a brief rationale on why the FASD Respect Act came to be. It gives contact information for the authors and the co-sponsors, and then just bullet point information. We get asked a lot by former co-sponsors what the comparison of the 117th Congress bill and the 118th bill looks like. So we'll have a sheet on that as well. A lot of them are also interested in the amount of money that has been spent on FASD programming, which is what the history of FASD program authorizations will show you. And we will also, upon request, have copies of the FASD Prevention and Clinical Guidelines Research Workshop Report. And that's a workshop report detailing the work we've done with our DoD and USIS partners. This might be of particular help for lawmakers who sit on armed forces committees or Department of Defense committees, as that is who our project was with there. Just want to check the chat real quick before we move on. Okay. Liz, in terms of folks registered for Impact Week, I know we have just under 70 registered for Hill Day alone right now, but I'm not sure of the final number for Impact Week. And are any of these available on the FASD United website? Absolutely. All of those documents are available on our policy website, nofaspolicycenter.org, under the for staffers resources page. There's also an advocacy page where you can find all of those. And when I publish the recap and video of this tomorrow, all of them will be attached there as well. So you'll be able to find them super easily. Okay, and as Jen and Susan both mentioned, the 118th Congress as a session is coming to an end at the end of December of 2024. And I just really, really briefly want to talk about what that means for this bill and what it means for FASD policy moving forward. We believe, and we have definitely done the work to make sure that the FASD Respect Act is well positioned to pass within the 118th Congress, specifically having it as part of the Support Act reauthorization. The work we are doing now is to continue to socialize the bill, educate legislators, and take their knowledge from simply being FASD aware up to FASD informed, so they can understand where FASD fits in to larger issues, essentially. I definitely want to reiterate that I'm optimistic. I believe Jen and Susan are both optimistic, and they've just done some incredible work along with the rest of the advocates. But if the bill, for whatever reason, does not pass prior to the end of the 118th Congress, that would most likely mean that the Support Act reauthorization didn't pass or simply wasn't heard. If that is the case, then once again, I think we are well positioned, and Jen and Susan, Tom, step in if you think I'm speaking out of turn, well positioned to include the Respect Act in the Support Act again in the 119th, which means we're not starting over from square one. All of the relationships that have been built, all of the socializing of the bill, making sure that the bill is as well positioned as possible, I think it would really pay off. So that way we wouldn't have to go back and try to come up with a brand new strategy or anything like that. And again, I definitely want to reiterate, not trying to sound pessimistic, still feeling very optimistic come the lame duck session, but just want to make sure everyone is aware that that's kind of where we'd be at with the 119th session. But I would be happy to hear from Jen or Susan or Tom if you have anything that you'd like to add there.
Yeah, Chris is absolutely correct. I mean, I think back to when we first did the Respect Act. I mean, I started working on it before we got you all involved. And it's like, we are so far ahead of where we were then and what we've done and who we've educated and how we've organized ourselves. So I don't think that any of us should hold our heads down and say, oh, this is never going to happen. I mean, we have made so much progress, and that's how, that's how the process works. I mean, some bills take, many, many years, depending on, lots of different factors. So this is, and we are going to, we talk about this is not a one and done. I mean, we know that there's lots other areas of policy besides the Respect Act that's going to require our continued advocacy.
Thank you, Susan. And Jen, before you add anything, I'm not sure if you were, but I see that Liz has a hand up.
Okay, go ahead, Dal.
Please.
Okay, so I just want to make sure I'm clear about it. As we are reaching out to people, not only in our meetings, but also, in however we're communicating with the offices, are we, for this, let's just call it till the end of the year, are we focused on talking about the act, I'm sorry, the Reauthorization Act, so they're aware, especially if they're in the House, they're aware if that's part of that, or are we still talking just about the two bills?
So I think the ask, and Jen and Susan, feel free. The ask is still co-sponsorship of SA 200, HR 3946, the FASD Respect Act. I think it makes the most sense to talk about those, to socialize them, to talk about what they would do. If you are able to, and you have the knowledge to talk about the inclusion within the Support Act, and you're speaking to somebody who would benefit from that information, so somebody on the Senate Help Committee, or more likely on the Health Subcommittee of the Energy and Commerce in the House, I think that would be beneficial.
Okay, thank you. And then just one other question is about the psychology of all this. So as we push information to our contacts, does it get them more motivated that people are coming on and being sponsors of this, that they want to be sponsors? Or is it like, oh, they got this covered, I don't need to engage in this, I got a million other things I got to work on? How does that work in this environment?
Can I talk to that, Chris?
Please.
What it does, and I've seen this happen numerous times, if you mention that the bill has been supported or co-sponsored by someone who their policy aligns with another lawmaker, I've seen them sign off on like that. Oh, so-and-so signed on to it? Yeah, we're there, right? So I think it's absolutely helpful. I mean, in some cases, yes, there's some tension between the parties. But on the whole, like, there's nothing in this bill that is contentious. There's nothing in this bill that is partisan. It's quite bipartisan. And there's, we have from some of the most liberal Democrats to some of the most conservative Republicans signed on as co-sponsors to this bill. So I think anybody we get in between, it is actually really helpful. It's helpful to say, yeah, and by the way, so-and-so in this state or so-and-so in your party has also co-sponsored it, because it gives it legitimacy. They don't feel like they have, it's not some one-off random bill that they'd have to really scrutinize. It's already vetted through other legislators. So it makes the staffer's job easier to recommend. Does that answer your questions, Liz? Awesome.
Thank you, Liz.
Great questions.
And Jen, I think I'm going to keep you in the hot seat as we move on to the slide.
Yeah, so we have a state data sheet for the FASD Respect Act. Many of you have used them. They're published up on our website. It's got some information about how the prevalence in the state and how the FASD Respect Act would help people with FASD in a particular state. About a year or so ago, we talked about putting together state report cards. And this was done through a project that we're working on with the Department of Defense, Uniformed Services University Health Science Center for Health Science Research. I always get that one messed up. Where they wanted to know the lay of the land in terms of legislation on and where states were at on FASD, because, for example, if they are, as part of their screening for military dependents in the military healthcare system and diagnosis for dependents in the military health system, let's say there's a law in one state that would maybe warrant child welfare getting involved. If there was a child that was exposed, that might be problematic to them. So they wanted to kind of see where everything was. So we compiled this data, which led us to thinking, okay, this should be like a state report card. Many states, and in the feedback we got, was a report card really comes across as a negative. And while many of us as parents are like, yeah, let's show them how, this is hard. There's not enough support. There's not enough there for us. People want to get involved with a positive, right? People, if you're selling something, if you're trying to get people to buy into something, they want to be involved with something that's winning, that something's positive, that something's moving forward. So we kind of had to change the format a little bit. So we built these state data sheets out of that data that we collected for the project, not necessarily focused on policy, but focused on, hey, kind of here's the lay of the land. And we're still refining them a bit. We ask 5 basic questions on the front around FASD. And we are going to refine the one on special education services, because we know that FASD is covered under IDEA. It just depends on how it's interpreted by the state in terms of whether it's covered under OHI or it's covered just in general. So we're going to have to tweak that question a little bit. But we just looked at some basic factors across every single state. Do they have FASD listed on their website under the Department of Health? Is it even on their radar? And so the nice thing is this can give us a big data picture of, what percentage of states even have this on their state Department of Health radar? What percentage of states include FASD in the definition of developmental disability? Are they tracking alcohol-exposed pregnancies in their state? Do they even have an idea of what's going on? And then on the back side of the sheet, it's talking about factors involved in supporting alcohol-free pregnancies. And so looking at this information, we're kind of evolving how we can use it. And this is something that is not a one and done. This is something, again, that we want to go back now that we're going to publish this information. We're going to go back now and re-ask these questions again and see if we can find some trends in how things are changing and measure those trends, because I think that'll be helpful overall as a movement in terms of knowing where we're at. If you don't know where you're at, how do you know where to go? So, I think there's other things we could definitely measure. I think there's other things we could definitely look at. I think it is incredibly hard because each state operates as though it was its own country almost in these respects to standardize the data. What we have done is gone through and done an initial sweep for any state that has an affiliate. We have run the data by them to get an idea of, hey, does this seem fairly accurate in your state? And then we've run it by some other stakeholders as well, just to kind of see how it's looking. But this was really built out of another project that was completely unrelated to policy, not really necessarily intended for policy use, that we're being able to multi-purpose, that this might be helpful in terms of talking to your state. Do you need to get legislation passed to have the state even mention on their website that FASD exists in the state when they've got, autism, Down syndrome, all the other disabilities listed? You don't need legislation to do that. You just need to talk to your state Department of Health, and they can do that. That's something we just did in the state of Washington. For example, I called them up and said, hey, you're not listing these resources under your developmental disabilities resources. You don't have a category for FASD. Can we please add that? So these are small steps that we can take, because in some cases, policy change isn't necessarily getting laws passed. It's changing how our systems of care do things. So, and yeah, Carl mentions in some cases, state data contradicts CDC data. If we're trying to get a baseline, where do we look at this? And yeah, I think there's lots of caveats for each individual state, but this is where the data kind of came from and evolved. And so what I'm looking for, and Sid, I see your hand up, and I'm really excited to hear what you have to say because you always have such great insights. But what I'm looking for at the same time is if there's something we can call these that aren't the state data sheets, because we kind of use that name for our sheets that we use for advocacy on the FASD Respect Act. We don't necessarily want to call them report cards. Is there something good we can call them? And so putting that in the chat would be incredibly helpful. And Sid, please pour your wisdom on me. I'd love to hear what you have to say.
Well, I'm delighted that you've done what you've done, and I think the data items are a great starting point. We're struggling with. We've got a statewide virtual conference coming up in November. We've invited a number of state officials to be part of a panel as a kind of a step toward a little more accountability for results than we've had thus far. But one of the documents that we're trying to produce is criteria for assessing a state's response to FASD. The data is a part of that. Have they assembled the available data in the state? CDC data is great, but there are 8 or 9 data items within every state that could be pulled together in one place and almost never are. That's a criteria question. That's a qualitative item that you can ask, are they doing this or not? It's not just a data point. It's what are they doing about the data? If they have a PRAMS number on alcohol exposure during pregnancy, what are they doing about that? Do they know what health providers are using as screens? Have they looked at the ACOG requirements as to what prenatal providers are supposed to be doing and compared that with what public and private providers are actually doing? The ACOG data, which isn't very current, suggests that a very small percentage of providers are using validated screening tools for alcohol exposure. So criteria for a self-assessment or an assessment by an advocacy group or an assessment by a national group goes perhaps the next step beyond data. Have they pulled together the data that's available, and what are they going to do about that? I think there are policy. We've come up with a dozen different policy and practice areas where you could say on a scale of don't know, we've talked about this, some pilot efforts, statewide systems in place, or some other assessment where a group within the state could ask those questions and get that much more specific than just the data.
That is such a brilliant point. And I love the next step and level up to this with that. I think that's where, and I know Susan put this in the chat too. I think this is maybe where the Respect Act can help with that process, because if we are having, giving states the mechanism or the funding to be able to bring together a state group, a state, I can't remember what it's called in the bill, I'm blanking on this, but like a state interagency coordinating committee, giving them some scaffolding to be able to use to measure. You're right, Sid. What are they doing with these things? They're doing them. Great. You have them. Check, 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 check. Okay, now what are you doing with them? And giving almost a strategic plan scaffolding for the state is what
Yeah.
I'm hearing from you in
Yeah.
terms of how they're handling FASD. Brilliant.
Sometimes having the legislation is deceptive. We've had a terrific law in the books in California since the 1990s that talks about responding to prenatal exposure. And there isn't a person in the state that's taking that seriously at the county level where most of the systems are administered. But we've got the law. And if you ask, do you have a law? Yeah, sure, we got a law. It's just never implemented, never backed up, the state never asked the question. The feds never asked the state the question, but we got a heck of a law. So laws are the first chapter of a long book. Implementation is the rest of it. And leadership, and grassroots pressure and media spotlights all come into the mix.
Excellent point, Sid. Thank you. Once again, California is leading the way
Well,
some of this thought process.
Aspirational anyway.
Love it. And thank you to everybody in the chat for the suggestions and ideas around what we can call this, put together, call this information as we're rolling it out. This gives us some really good ideas for how to launch this. And I really appreciate this group for being kind of an insider group in terms of new things we're doing and just giving us that feedback. It's very helpful to have this group supporting. So thank you all. I know we're at the end. I don't know, Chris, if we had anything else to cover. I want to be respectful of time. We're at the end of our time together. We will have a policy forum in September, always last Wednesday of the month. So we will look forward to seeing you all then. And as always, if you need anything from us, please reach out. You have our phone numbers, you have our emails. Give us a shout. Thanks again.